have useful phone numbers you can use. And so the website is Medicare. That's pretty simple, 212 for area code 212.com. And if you have any questions afterwards, that are beyond the scope of our being able to answer, just email me at jess@medicare212.com. And Gemma will have that information as well. And so, while we're waiting, everyone I know who, has come to understand what's going on with Medicare, no one has ever absorbed it in just one pass. It takes several passes. So what I'm going to try to do today is to really stay with a few basic topics that are relevant to Medicare's open enrollment period. That's the period we're in now. And actually, the real name for it is the annual election period. Because when you elect, you get to choose a new Medicare plan or plans for 2021 if you want. But for years, it's been called open enrollment. You're not enrolling. And that kind of mislabeling is very widespread in insurance and in Medicare, and it makes it really confusing. So between October 15th and up to December 7th, we who are on Medicare, including me, have the option of choosing a different plan for 2021. And this will be, I think, the 8th year. I've talked about this at the Isaac Center, and I always encourage you to understand the source of the information you're absorbing. And my credentials are I'm a board certified patient advocate, and I'm licensed as a Medicare consultant in New York State through my broker's license, although I don't sell insurance and act in that capacity. And I really got my training at the Medicare Rights Center. But for anyone who works with me, what you'll find is I tend to either send you something written in an email, or I'll send you a link to something on the internet, because when you don't use the exact words for something in the Medicare business or the insurance business, you end up asking the wrong question. It's not the question you think you're asking, and you get the wrong answer. So we're
really quickly, so I'm going to go ahead and mute everyone. So I just want to remind everyone, he's going to give a very, he's going to give an overview of information about Medicare, the open enrollment period, and give you, one crash course in Medicare. I'm going to mute everyone. He's going to kind of talk through, and then there will be time for questions at the end. You will have the opportunity to unmute yourselves, but as of right now, I'm just going to mute everyone so there's no background noise that interferes. Jess, you have to unmute yourself. Sorry.
okay, I'm unmuted. So can everyone hear me? Okay, good. So we're going to cover the three big choices you have during the open enrollment period. The first is whether to be in what's called original Medicare or Medicare Advantage. The second, if you're in original Medicare, is which Part D prescription drug plan to have. And the third is also, if you're in original Medicare, what Medicare supplement or Medigap plan to have if you're going to have one at all. And one thing that you encounter is when you're trying to decide between original Medicare and Medicare Advantage, part of your decision is based on what you would end up with drug plans. So to make it as simple as possible, there are two big delivery systems in Medicare. Original Medicare. Sometimes it's called traditional Medicare. It's the Medicare that people have been on since 1965 when Medicare first went live. And when you're enrolled in Medicare, you usually get that paper card, and that's all you need to be able to go to the hospital or to see a doctor. Medicare Advantage, kind of had its beginnings about 30 years ago when private insurance companies came to Medicare. This was during the era of HMOs, health maintenance organizations, and they said, we're private enterprise, and we think we can do a lot better job than you do. We think if you just give us what it costs you to take care of one of your patients each year, we can give them better care because we'll manage it more actively, and we can save money because we'll keep an eye on unnecessary tests and the like, and we'll save so much money that we can offer some extra benefits, like we might be able to offer some vision care or some dental care. So those are the two basic systems, and I'm going to get into it in just a little bit, but the first thing you want to do is figure out, well, how do I know which one I have? Because I find a lot of people are confused about this. So in general, if you go to the doctor, and when you go to the doctor, you show the doctor a plastic card that's your Medicare Advantage Plan insurance card, and that's the same card you use when you go to the drugstore. And if when you go to the doctor, you have a copay, $20, $10, whatever it is up front, if that's how your insurance works, you're in a Medicare Advantage plan, like AARP, United Healthcare, Blue Cross Blue Shield. If when you go to the doctor, you only use that paper card and maybe a Medicare supplement card, but don't worry about that yet, and you need a separate card when you go to the drugstore, then you're in original Medicare. Now, to really get into this, I think all of you have probably either received this in the mail. This is called Medicare and You 2021. That's the Medicare handbook. And if you go to my website at Medicare 212 and look for the tab that says Get Help, you'll find a link for that, and you can actually download it. And, this is very big and intimidating, but it's really very important because they have a whole group of experts who write this, who were trained in how to explain things as simply as possible. And they do about as good a job of it as anyone can. So if you want a clear, accurate explanation from the source, you'll find it here. And I'll just point out to you, if you open it, the first thing you see is a table of contents. And then if you go to the next page, I'm going to just tell you what you see here. You can go back and see it for yourself. So right here on page 6, you see a page that says Get Started. And that explains that we're in the open enrollment period right now, and that your new coverage starts January 1st, but there's something very important here. It also tells you that if you're in a Medicare Advantage plan, you can still change that plan to another Medicare Advantage plan or back to original Medicare anytime between January 1st and March 31st. So it's almost like there are 5 months when you can change your plan. So, when you think about what we say, and you're in Medicare Advantage, give yourself some time to think it over. And then here, on the next page, they go into what are the parts of Medicare you probably all heard of: A, B, C, and D. And why do they call them that? And it's because it's named after the parts of the actual document of the law that was passed in Congress. And so Part A is your hospital insurance. And how do you pay for that? It gets taken out of your paycheck, just like Social Security. And when you turn 65, you are covered by Part A. Part B covers everything else that's outpatient. And how do you pay for that? You pay a premium to Medicare. It's probably taken out of your Social Security check. What's Part C? Part C is Medicare Advantage. That's Parts A and B combined. And then it also includes Part D, which is prescription drug plan. So after we've looked at that, you then go to the next page. You're going to find an index in the front instead of the back, because that's really how you use this book, is look at that index right in the front, and you'll be amazed what you can find there. And then finally, you're going to come to this page, these pages here. I think you can see that. And these tell you what your Medicare options are and the differences between Medicare Advantage and Original Medicare. And so I'm going to do something, you know, people who explain this won't do it this way because they want to follow the chart and everything. But I'm going to try to distill it down into bullet points for you. And the bullet points, my bullet points are this. Original Medicare gives you better access to Medicare. Medicare Advantage is a better deal. So people who want or need are concerned about access to the most doctors, they try to go to Original Medicare. And people who want simplicity, everything on one card, they're going to tend to go to Medicare Advantage. I'll tell you another way to look at it, not that this should influence anyone's choice, but what kind of people go for Original Medicare versus Medicare Advantage. Original Medicare, I would say, you know, working with people in New York, the closer you get to Fifth Avenue, the more likely someone is to have Original Medicare. The closer you get to First Avenue, the more likely they are to have Medicare Advantage. So what are these main differences now? There are two other big differences, actually, I want to mention that are important. One is Original Medicare is the public option. It's run by the government. Medicare Advantage is run by private insurance plans to government specifications. And so the government is accountable to us, the people, through our elected representatives, such as they are. The private insurance companies are most accountable to their shareholders. And all their shareholders want is money. So there's always a conflict of interest when you're providing care, in that if you can deny care, you save money, especially if it's expensive care. I'm not saying that all the plans do that, but the definition of a conflict of interest is not that you screwed someone, but that there's always a temptation to screw someone to get more money. That's just a fact that we all know about. And then the second thing, besides one being private and the other not, that slipped my mind, but I'll come back to it. So the first thing to understand, oh, now it comes back to me. Another difference is the Medicare Advantage plans spend millions of dollars on advertising. And because of that, we know a lot more about that than we do about original Medicare, who doesn't advertise at all. So if I seem like, you know, I'm biased toward original Medicare, part of it is I'm just trying to get out what the information you're not going to find in the deluge of advertising for Medicare Advantage. So here's the first big difference. Every doctor who takes a Medicare Advantage plan also takes original Medicare. But there are doctors who take original Medicare who don't take any Medicare Advantage plan. The reason for that is if you're going to get paid by Medicare, either directly or through an Advantage plan, you first sign up and you agree to take Medicare patients who have original Medicare. Then you can join the Advantage networks. So when I say original Medicare gives you better access to medical care, it's because there are more providers available, and there always will be, for the reason I explained. One example in New York is Memorial Sloan Kettering takes original Medicare, but they do not take Medicare Advantage plans. An interesting reason why they take original Medicare, it's because Medicare is the biggest funder of residency programs in the country. So every teaching hospital like Sloan Kettering almost always takes original Medicare. The second thing you want to know, and this relates to access to Medicare, is that you can use original Medicare anywhere in the country. That's not true of most Medicare Advantage plans. Some of them have PPOs where you can see maybe doctors who take Medicare but don't have Medicare Advantage. But basically, you're confined within your HMO, which is always local and regional. Usually, the way this is presented to people is, well, this is something to consider if you spend half the year in Florida or if you travel a lot. And that's for certain. Then it would be a big advantage to be able to see a doctor wherever you are. But the other thing to consider is if you're ever really sick, you may be told that this is your condition, and you know what, there are only a few people in the country who know how to treat it. And one of them is at the Mayo Clinic in Rochester, Minnesota, and the other is at Johns Hopkins in Baltimore. With original Medicare, if you can get yourself down there, you are covered exactly like you would be in New York City. Not so with Medicare Advantage. So that's an important thing to look at because, you know, when we're relatively healthy, you start looking at these plans and you look at, you know, the co-pays and all that. You're thinking about it when you're healthy, but the real purpose of insurance, the most important thing, is to protect you when a catastrophe happens. A third difference is most of the Medicare Advantage plans require you to get a referral to see a specialist. You never have to get a referral in original Medicare. Another very important advantage is Medicare Advantage plans use what's called prior authorization. So if you're going to have, say, elective surgery, especially if it's expensive, they may require your doctor to submit a request and demonstrate why this surgery or whatever it is medically necessary. And 80% of the plans use this, and there was even a study that came out a few years ago from the Federal Office of the Inspector General, and it was about concern about the rate of denials in the Medicare Advantage plans. So that's another reason why there's it's better access to medical care. There's nothing to come between you and your doctor. And those are really the main advantages. So what are the advantages of Medicare Advantage? And they're going to be mostly monetary, as you're going to see. One is, I think there are 12 different plans in the New York area, at least, where for no extra money compared to original Medicare, they will throw in a free prescription drug plan. How much is that worth? Well, the cheapest monthly premium on a prescription drug plan this year in New York is less than $8. But it's worth something, and also it's simpler. You just use the same card when you go to the pharmacy. A second difference that we alluded to is when you go to see the doctor, you have a fixed copay, which is going to be like $10, $20, something like that. With original Medicare, there's no fixed copay. You have what's called coinsurance. A copay is a fixed amount. Coinsurance means you pay 20% of the Medicare approved rate. So let's look at how that works. Let's say you go to the doctor's office for a 15-minute visit. Medicare says to the doctor, we think that's worth $100. That's the rate. The patient pays 20%, you pay 80%. And so people get scared because they think, oh my God, well, 20% versus $20, 20% of what? The rates are really very low, and sometimes, when I go to see the doctor, it's $18, $16. A longer visit could be $33, but that 20% is definitely not prohibitive. And when evaluating the Medicare Advantage plan, realize they have to stay within the limits of what it costs to take care of the average Medicare patient. So they can't charge too much less, or they would go out of business. Another huge difference is they are allowed to offer extra benefits like vision care, dental care. They might offer some hearing care with hearing aids, gym membership, and last year they were able to start adding on, if they wanted to, other benefits like driving you to the doctor. So all those things can be a consideration. And finally, the Advantage plans have what's called an out-of-pocket cap. It's a cap on out-of-pocket spending. So this is an important, concept. But I think you can see already here why, if you were on a tight budget, the savings and the extra benefits you could get from Medicare Advantage would be attractive to you. Out-of-pocket is how much you pay to the doctor or you pay to the pharmacy. And in the case of in the case of Medicare Advantage, in this year, for example, if you have a really bad year and you have to spend more than $6,700 out of your own pocket, the Medicare Advantage plan will pay for the rest. That's something that came in as part of Obamacare. Original Medicare doesn't have that. It's a big defect in original Medicare. There's no limit on what you can pay out of pocket. Okay, so those are the basic differences, and you can read more about it here in the book. But what you're really looking at is, if you want to be able to see more doctors, more hospitals without any restrictions because of prior authorization or referrals, then you want original Medicare. And studies have been done that show when people get sick, really sick, they tend to jump out of Medicare Advantage into original Medicare. Okay, so that's the first big choice is original Medicare versus Medicare Advantage. Uh, let me see, I think someone's entered the waiting room. Gemma? I'm not
I just
sure.
admitted them.
Okay. Uh, oh, okay, wow, we have a whole bunch of people here. Okay. So this is where we now come to what are called Medicare supplements or Medigap policies. These are really confusing, and I'm going to do the best I can. But here's the simplest way to think of what Medigap is. Think of the concept of the out-of-pocket cap, where an insurance company like the Medicare Advantage plans say, you have to pay your share, but after you hit $6,700, we will pay for all of it. That's a cap. What a Medicare supplement does is it's a way of putting a cap on your original Medicare. And the most popular way of doing that is for people to buy Medicare Supplement Plan F. Now, we have all these letters here, and I'll get back to that, but let's just look at the concept of Medicare Supplement Plan F. It costs about $300. Most people get it from AARP, United Healthcare, because they're either the cheapest or one of the cheapest, every year. And when you pay them that $300 a month, when you go to the doctor, you show the doctor your paper Medicare card, you show them the Medicare supplement card, and they put the number from the supplement card on your Medicare claim. They submit the claim to Medicare. Medicare pays the 80% to the doctor, just like we talked about. But if you didn't have a supplement, the doctor would then bill you for the remaining 20%. But if you have that Plan F, every time that happens, Medicare will forward the claim to Plan F, and they will pay the doctor the remaining 20%. So for people who have Plan F, if they're going to the hospital or they're going to a doctor, they never see a bill. Now, one of the reasons there's a good thing and a bad thing about that. The bad thing is people think, well, if you have original Medicare, you got to spend an extra $300 a month, and who wants to do that? And that's a good point. And by the way, you don't have to have it. It only is a concern when you have a lot of expenses you have to go through. But let's say you were hitting that $6,700 out-of-pocket cap with Medicare Advantage. Go buy Plan F. It's going to cost you $3,600 a year. And you will save the difference between $6,700 and $3,600. Okay, so that's the logic for the cap. And there's also something called high deductible Plan F. And that's really interesting. Instead of that costing $300 a month, it only costs $70 a month. So the only problem is you have a deductible of about $2,300. But here's the thing. If you run all the way through the deductible and you spend $2,300 and you add on your premiums, which are another $800, that takes you to $3,200. You would still save $400 over Plan F. And if you're relatively healthy, you would save a lot of money. So that's what the Medicare supplements do for you. And my primary concern really is that no one who wants original Medicare, if possible, should be deterred from it because of the expense of the Medicare supplements. You know, the supplements are regulated by the state insurance commissioners. And in all but 4 states, if you want a Medicare supplement, you have 8 months from the time you turn 65 to get it. Otherwise, after that, if you have pre-existing conditions, they can turn you down, they can have an elimination period, they can charge you an extra. There are 4 states that are different, and New York State is one of them. In New York State, you are entitled to buy a Medicare supplement 365 days a year. And no matter how old you are, you pay the same thing. And no matter how sick you are, you pay the same thing. The only problem is they can put a waiting period on you of up to 6 months for pre-existing conditions. But that cheap plan I mentioned to you, the Plan F high deductible plan, only has a 2-month waiting period. So I'm telling you this because if for any reason, like you're in Medicare Advantage and you know, all of a sudden you get sicker, keep in the back of your mind that you can jump into one of these Medicare supplement or Medigap plans anytime you want. And you could just take original Medicare and not pay for it. And then if you got sick, you could jump into the high deductible plan. You'd have a deductible. You'd have to wait 2 months, but then you would be covered. We have that advantage in New York, and we pay higher premiums for it. Every state should have, you know, that advantage. So I'm not going to go further into it than that. And if there's interest, what we do at the Isaac Center is we'll have a follow-up just on the Medicare supplement plans where we go into great detail. We had someone, I think you saw the quote in the email, who actually came last year and they saved over $1,500 this year by changing their plans. Okay, so finally, we're going to take a look at the Part D prescription drug plans. And again, these are only relevant for people who have original Medicare. And there are 27 different prescription drug plans in New York. And if you take drugs regularly, what you can do is go to the Medicare.gov website. The web address is on my website at Medicare212.com. And they have a tool called Plan Finder. And you enter the drugs you take regularly in there, and you enter the pharmacies you use, and then the Medicare computer runs through it all, and they tell you what the least expensive drug plan will be for you. Now, by the way, if you are shopping for a Medicare Advantage plan, they will do something similar to you. If you enter all your drugs in, based on that, they will estimate what the cheapest Medicare Advantage plan is. And they recommend that you do this every year because the plans change around how much they charge for drugs, whether they put them on a lower tier or a higher tier, maybe even whether they even have them on their formulary or not. And only 5% of the people use this tool, and as a result, studies have shown people on Medicare prescription drug plans pay on average $500 more a year than they would if they switched to a cheaper plan that is available. So that's the reason you want to use that tool. Now, it's a pretty complicated tool. They made it maybe as simple as they could, but it ain't easy to use. So what you want to know is you can get someone to assist you in using it. Before the pandemic, if you belong to the Isaac Centers, you could go to any of the social workers and they will sit at the computer with you, and you can enter your drugs, and they will help you to find out what the cheapest plan is. That's one way you could do that. Same thing if you're shopping for a Medicare Advantage plan. Or you could call 1-800-Medicare, and they will do the exact thing for you with either a prescription drug plan or a Medicare Advantage plan. Or you could call SHIP HICAP, that's on the website. And finally, for drugs only, you can call the Medicare Rights Center, and all this information is on the website, and they will also assist you personally over the phone. So I encourage you to do that. And, you know, a few years ago, Consumer Reports did a study, and they wanted to find out how much variation there was in what people paid for drugs in various cities. So they came up with a basket of 5 different drugs that people commonly take, and they looked at how much they cost in 5 cities, and they found a lot of variation from city to city, and they also found a lot of variation between the cheapest plan and the most expensive plan. And I've taken those 5 drugs, and I've done this study for New York. And what I found out is that the cheapest plan for those 5 drugs is about $300 in New York. But if you chose another plan, you could be paying as much as $3,000 just for these 5 common drugs. And this year, the lowest premium plan in New York is something from SilverScript called SilverScript Smart. And the monthly premium is only $7.30. They weren't the cheapest overall, because what this plan finder does is it figures out what, during the course of a year, how much you're going to pay in premiums and how much you're going to pay when you pick up your drugs at the drugstore. That's your total cost, and that's what you want to know. So if you chose, say, the AARP Medicare Preferred Plan, which costs $94 a month, this year you would have ended up paying close to $2,000 once you add up the premiums and the cost of the drugs. And a lot of people think, if they can afford it, well, I want the best. So you know what? The more expensive plan is probably the best, because that's going to be cheaper in the long run. And every time I've run these numbers, I've found no evidence for that at all. In fact, if you have a $90 premium, you've got to, you know, do a lot of drugs to be able to make that up in savings. Furthermore, I've never seen any of the drug plans say that our more expensive plan is better because it will save you more money. In reality, they don't tell you anything except one may have a lower deductible, it may have this and that. My background, business background, is advertising and marketing. And the way these plans are structured in terms of their premiums and everything, they're structured to, sell, really. So just because something has AARP on it, don't assume it's the best. You know, AARP plans are all operated by United Healthcare, and they pay United Healthcare $600 million a year to use that name. Pardon me, United Healthcare pays AARP that much money, and they tell you at the bottom in fine print, we're using the name, but they're not saying this is the best plan at all. They're just saying it's okay. So why do they do that? That's what marketing is for. That's what advertising is for. And for those of us who join AARP when we're 50 years old, by the time we turn 65, we've been seeing advertising for the AARP plans in AARP magazine, and we're ready to jump in and trust them. unless they make a specific representation to you, it's almost always best to go for the lowest cost plan. And by the way, the same thing is true with the Medigap letter plans. Like if someone sells Plan F, it's exactly the same from one company to the next. There is absolutely no difference in the benefit to us, the patient. The only difference is the price. So therefore, you should go for the lowest price. Do not be fooled by branding. If you're worried with insurance, well, I know I can trust United Healthcare. This high deductible plan is from Globe Life. I don't know who the hell they are. New York State has about the toughest insurance laws in the country. And I've never heard of any one of these plans going bankrupt or, defaulting on, payments, and there's no reason they should. So I would encourage you to go for the lowest, price. So very basically, those are the three areas where you have a decision to make. The first decision is between Medicare Advantage, the private option, and Original Medicare, the public option. If you choose Medicare Advantage simply because if you would prefer Original Medicare, but you think it's too expensive, you want to come to follow-up if we schedule one on the supplements, and also look into prescription drugs, because you may find that you save money, or you might decide, okay, I just can't afford that. But you keep in the back of your mind that you still have until December 15th to change. And if you're in Medicare Advantage, anytime between January 1st and March 31st next year, you have an opportunity to change. So this is what we in New York are gifted with. We are not locked into something for the rest of our life because of a decision we made when we're 65, and there are lots of ways you can take advantage of that. Then the second area is the Medicare supplements, okay? So how do you save money there? When you read their advertising and they say, we help you pay for your medical expenses. They do, but first you pay them a lot of money each month. If you look at how much money you pay out of pocket for your medical expenses and you don't have a supplement, you can see if it's, if you're averaging $300, $400 a year, and you're very healthy, it's not that big a risk to just say, I'm going to have Original Medicare and I don't need a supplement. But if I do need a supplement, I know how to jump in and get one and limit, the damage if I'm going to be, real sick. So you have that option available, and you can also look at the other letter plans. And then finally, you have your prescription drug plans, and that's just kind of a no-brainer. You can't lose. Get help, do it yourself if you're handy with a computer. The one thing you got to remember with the prescription drug plans when you use the Medicare Plan Finder tool online is this. It's going to ask you to indicate up to 5 different pharmacies. And it may say something like, tell us your pharmacy. Tell them your pharmacy, but if your pharmacy isn't CVS or Duane Reade, put that in, and put in a couple of others as well. Because when they tell you the lowest cost plan, it is only good at the lowest cost pharmacy. So depending on where you use that prescription drug plan, it can cost you more at Duane Reade than at CVS or vice versa. That's why you always want to dig down in that tool, or if you're working with someone, tell me what pharmacy I need to use. What they usually do is they designate a preferred pharmacy that's the cheapest, then standard in-network pharmacy, they're the next cheapest, and then out-of-network is the most expensive. So I'm going to stop right now. So if you want, you can unmute yourself and ask questions. And I'm looking at how many people we have here. And it's a pretty good turnout. So on my own initiative, I'm going to get with Gemma, and we're going to schedule a second seminar where we'll briefly go over what we covered here, but we're really going to focus mostly on the Medicare supplements, the Medigap plans, you know, for people who want to understand more about that. And we're going to focus more on the prescription drug plans. Okay? So, anyone who has a question, go ahead and unmute yourself and shoot. I think we also probably have a chat function, but go right ahead. Oh, I see I have chat open here. Okay, here's a question. I've looked at some of these add-on dental plans, and they don't really seem to cover that much. That's true. There are a few plans. I think Emblem has some plans that have pretty good dental plans. But you know, the fact of the matter is most of these plans, the reason they offer these benefits is their marketing tools. So dental plans usually just cover very simple dental care and cleaning your teeth, and only with certain dentists. Vision care might cover a couple of $100 for glasses. So before you make a decision to choose a plan based on those benefits, look at exactly what it is. Okay, I have another question here, and this is from someone who has just retired and has original Medicare. And the question is, what do you need to do? Okay, so the first thing you need to do is make sure you actually have it. You know you have it when you've got that Medicare card that says right on it, you have Part A and Part B. If you're unsure, call 1-800-Medicare. When you call 1-800-Medicare, ask them to assist you if you need assistance in registering on the Medicare site. That is the most important thing. The next thing you have to do is you need to get a prescription drug plan. I've actually met, you know, quite a few people who say, well, I don't need a prescription drug plan because I don't take prescription drugs. And whether you take, this is insurance, you know, it's like saying, oh, I don't need our auto insurance because I'm not going to get in a car wreck today. You don't know that. You don't know that you're not going to have to walk into the doctor's office in a week and the doctor is going to say, you need a drug that costs $100 a month. You do not want to be without a prescription drug plan, okay? Then the next thing you want to do is to look at Medicare supplement plans because people are going to tell you you need a Medicare supplement plan, and you would want to come to that follow-up Zoom we're going to do. But I'll tell you, about 6 or 7 years ago, the New York Times did an interview with Joe Baker, who was president of the Medicare Rights Society. And they finally pinned him down and said, what would you recommend for your grandmother? And he said this, for what it's worth. He said, well, when she turns 65, I would recommend original Medicare and a prescription drug plan. And then when she turned 75, I would recommend that she pick up a Medicare supplement. Why is that? Most people are relatively healthy between 65 and 75. And in a normal year, you know, you might end up with a little physical therapy, an x-ray, maybe a CAT scan, 10 office visits. you could end up with out-of-pocket expenses of, say, $600 or $700, something like that. That's not untypical. And so that's something you could do, and there are people who go ahead and do that, keeping in mind, anytime you want to get a Medicare supplement in New York, you can go ahead and do it. But between the ages of 65 and 75, the supplement plans are making a lot of money. And there are even charts out there on the internet you can get where it shows how much they have to pay out at the various ages, and it's cheaper earlier on. Okay. And then someone here says, I already have the card. I have a plan with, and then it's the name of a union and one of the drug plans. Okay, so a lot of people transition into Medicare through their union, their company's retirement plan, or their company when they're still working. And in these cases, the company may have arranged a plan, say, with United Healthcare. I mean, some of these plans are pretty luxurious. You and I couldn't buy them, but they're done through United Healthcare. Other plans are not that great, and you might decide you would rather be with, if you're in a Medicare Advantage plan, Original Medicare. What they don't do a very good job of is explaining to people at the outset the full range of their options. So, I think it's a good time, this time of year is a good time to bone up on your options. And like I said, we'll try to schedule a follow-up later on. And we're getting near the end, so if any of you want to email me with a question, it's Jess, Jess, at Medicare.com. Pardon me, Medicare212.com. And you can go to Medicare212.com and you will see my email address there as well. And you can also phone me. My office phone number is there, but I usually just let it go to message because of all the auto dialing. But you're free to go ahead and leave a message there, and I will certainly call you back and answer any brief questions you want to have answered. Okay.
So did you want to do the meeting? So
well, let me. We had spoken about, Gemma, doing a follow-up week from today, right?
Yeah.
And my concern was people might be too distracted by all the stuff going on around the election. But, I don't know that that's the case. That's just, a concern of mine. But otherwise, November.
Anyone have any opposition to that?
You can use the chat function, or let me hold on. If you have opposition, if your video is showing. Okay, well, so Gemma, why don't we go ahead and schedule it for a week from today at noon?
Okay, so next week, we'll be going over prescription, you said, and part.
Well, we're going to go over everything we covered now, but we're going to spend most of the time on the supplements and on prescription drugs. And also, I will stop a lot earlier so people have a chance to ask questions. I'll probably stop at